Excuse me. Thank you very much, Derek. Thank you, everyone, for joining the call. I especially want to thank the members of my team that are on this call and all those who are working, all of our essential government employees who are working today and every day as part of the COVID-19 response. So we've spoken about this before. We talked about it yesterday a little bit, and that is all of the expressions of support that we have seen for our healthcare workers on social media, in Facebook postings, and the people who have lined up at hospitals and cheered on workers, those who have come together in unison to provide expressions of support for our healthcare workers. That is so critical because we've been speaking about them every day and what they're doing and the battle that they are in right now to save people's lives. And I have said every day, it's an extraordinary thing that they are doing, the courage that they have shown. These are people who are working shift after shift after shift in an intense environment that is akin to, or is the medical equivalent of, a war zone. That is what they are operating in each and every day, and they are coming back and back again, re-entering that war zone because it's who they are, it's what they believe, it's the oath that they've taken to do everything they can to help save lives. And it is inspiring to see what they are doing, and that's why all of these expressions of support are so wonderful, and I'm grateful to see them all across the county. But what they're doing, I've pointed this out on many occasions, while they are out there fighting to save people's lives, they understand they are putting themselves at risk, and they're putting potentially the safety of their own family at risk as well. And that's what makes them heroes for what they're doing. And I think yesterday, in the reports of a nurse from Huntington Hospital dying, a nurse who treated COVID-19 patients, dying as a result of this outbreak, is a important reminder, a poignant reminder to all of us of what these healthcare workers are doing for us right now. As I speak, as this call goes on, and every minute and every day, 24 hours a day, 7 days a week, what they're doing for all of us and working and fighting every day to save people's lives. And our heart goes out to his family and to the broader family at Huntington Hospital. We're grateful for all the work that they are doing, and all of them are in our thoughts and prayers right now, all of us in Suffolk County, and for all those healthcare workers. And so those expressions of support are important, and what we do is most important. How we conduct ourselves, how we make sure we're following health guidelines to reduce the impact of the virus. All of that is important to honor those healthcare workers. But every way that we can express that support is wonderful, and it is inspiring to see, and I'm really grateful for it. So tonight we will be seeing some additional support happening from our fire and EMS agencies. They will be tonight at 7 p.m. sounding their sirens at 7 p.m. in unison to support healthcare workers and to express our gratitude and our support for what they're doing for us. So I want to thank the Suffolk County Fire Chiefs Association for putting out that call. We will be here in Suffolk County lighting up the Dennison building in blue in tribute to all of our medical workers and healthcare workers, and we will continue to light the Dennison building in blue throughout this crisis moving forward. So tonight at 7, we're going to hear some of those sirens going off in our communities across Suffolk County. And I think it is particularly poignant that our fire and EMS agencies, who are also on the front lines, particularly those EMS workers who are picking up patients and healthcare workers who are transporting they're on the front lines as well. And the fact that they are saluting tonight and acknowledging the incredible work and sacrifices being made by our healthcare workers, I think is a wonderful thing. And so tonight at 7, maybe go out on the porch, listen for those alarms of sirens going off, and know that it's just another expression of support for the men and women in our healthcare industry, in our hospitals and nursing homes, assisted living facilities, and urgent care, so everybody who's treating patients right now and trying to save people's lives. So I want to talk about masks. Again, this question came up yesterday. We know that the CDC has put guidance out now recommending that people wear masks, what I would call, or face coverings. And I think it's important to make that distinction between mask and face coverings. I showed yesterday this surgical mask, as I talked about the supplies we have and the fact that we have given out 1.7 million pieces of personal protective equipment, and we're essentially out of what we are distributing, and we're continuing to bring things in. I'm going to talk about that a little bit more. But this is a surgical mask. You've seen this before. I have a sample of the N95 masks. This is an N95 mask. These masks are for our healthcare workers. And so while the CDC is recommending that we wear masks or face coverings, it is important that we're not utilizing these masks, but we are utilizing what you would call homemade. And why that's important is because when there is a limited supply, when there's a limited supply of masks out there, we want to make sure they are available for our healthcare workers. So we are putting out on our Facebook page and our social media sites, in every way we can, ways that you can make your own masks and what I'm calling face coverings. So I will be wearing, this question came up yesterday, I will be wearing, when I am out in public, a face covering. When I am out in a store, if I'm out anywhere, I haven't been going to the store much, but when I'm out in public, I will wear a face covering in alignment with the guidance from the CDC. And I think that is important because from the very beginning, we have tried to follow the guidance specifically that has been delivered by our healthcare professionals, so that we are modeling in Suffolk County exactly what we're asking other people to do, exactly what we're asking county residents to do. And so in line with that, when I'm out in public, I will wear a face covering. We have a group in my community in Bellone that is actually working to make masks and sewing masks. So one of our friends is doing that for our family, for me. So I will be wearing that. I thank them. And we have groups all across the county that are forming sewing groups. Out of our economic development department, we have what we call now the Suffolk Sewing Cooperative, that are a little group that really emulates what's happening in smaller groups all across the county. People who are just looking to do something to contribute and to help. I think it is very important to say, in addition to the fact that we shouldn't be using masks that are necessary for healthcare workers, that we are utilizing these face coverings as an additional protective measure. This is not a replacement for the social distancing and the staying at home guidelines that are in place, the orders that are in place from New York State. Those measures are absolutely critical to flattening the curve and supporting our healthcare workers. What a face covering will do will have some impact when people have to be out, and they are out to do things like pick up food from the grocery store or supplies. They're not designed to protect you, but to reduce the transmission of germs in the air, and as a result, reduce the ability for the virus to transmit to others. So it is an additional protective measure. It's a good thing to do. I don't think there's solid data on how much it will impact, but to the extent people have to be out right now during this crisis period, wearing that protective covering, that face covering, can help reduce the transmission of the virus. And anything that we can reasonably do to reduce transmission, we should be doing. And that's important. So I'm going to follow the CDC guidelines. I will wear a face covering when I am out in the public. I encourage everyone in the public to do the same when you are out. And there, as I said, there are people who have formed sewing groups across the county, but you don't even need to sew to have a mask. You could use a t-shirt, a bandana. And actually, the Surgeon General has put out a PSA on this, which we will be highlighting on our Facebook page and on our website as well, that you can go to. And it's very quick, very clear. Shows how you can take a old t-shirt or a new t-shirt, whichever you want, from your house, and very quickly, without sewing, turn that into a face covering to wear when you're out in the public. So I encourage everyone to follow those guidelines, and we will be doing that in Suffolk County. I talked yesterday about supplies. I obviously showed the masks that are being utilized by our healthcare workers that we have been distributing. We've distributed all the supply that we have in Suffolk County that we had on stock in hand. We've distributed out what we've collected through our supply drives and all the additional supplies that have been delivered by New York State with the leadership of Governor Cuomo. And the governor has been incredibly articulate. He has shown great leadership here and continues on a daily basis to talk about the need for bringing those supplies here to New York. He has done everything that you can do to do that, and appreciate that. We've distributed out what we've received from New York as well. But effectively yesterday, we were down to zero of what we could distribute out. I spoke with a number of different officials across, I have spoken with a number of different officials across this county. And I think it's important to say during this crisis that politics is completely irrelevant, and it has absolutely no place in any discussion right now about what's happening and what we're facing. And I can proudly report to the people of Suffolk County that my experience throughout this crisis has been that public officials across this county have done exactly that, have put politics aside. We're on a call every day. I'm on a call every day with our town supervisors, our village mayors, their staffs, and going back and forth on all of the issues, all of the questions that the public has and that are happening right now. And I can tell you there's not a whiff of politics in those conversations. I don't care what party you're in, it has been put aside, and that's exactly what should be the case. And the same thing with the members of the legislature here in Suffolk County. I have told them repeatedly what a pleasure this has been to be able to work through this crisis with all of my colleagues without politics being involved in every way. And I really compliment them and thank them for their leadership in this time of crisis, because that's exactly how it should be. And we need every level of government to be working together in that way. And, you know, this crisis, as we've seen every day, as we talk about the numbers, this is about life and death. This is about who we are as people. It's about humanity. This has nothing to do with politics. And so it's important at every level of government that we're doing that. And I can tell you that 2 days ago, I had a conversation with one of our representatives, Congressman Lee Zeldin, and he expressed his support for Suffolk County and what we're doing here and the response here. And we had a very good conversation. I talked about what we were doing, what we were facing, and what we needed here. And I'm very happy to report that Congressman Zeldin has worked with the White House and has secured a commitment that Suffolk County will They will work to make sure that Suffolk County has what we need in the next 30 days, particularly as we go through this crisis, for our frontline workers, our hospital workers, and our police officers, our first responders, all of those people who are part of the response to the COVID-19 virus. And that is very important for the people of Suffolk County to know that at every level of the government, we've seen that Governor Cuomo has provided great leadership in the state, has worked closely with the White House, but knowing that Congressman Zeldin has secured that commitment from the White House. I know he's spoken to Jared Kushner. That is a significant thing for the people of Suffolk County, that we have that commitment from the White House. And I know the president knows Suffolk County. He's from Queens. He's been to Suffolk County during my tenure here, during his presidency. He is, I know, has friends who are here in Suffolk County now. So he knows Suffolk County, and he knows what a big place this is. We have 1.5 million people in this county. So I want to thank Congressman Zeldin, and we will continue to work together. And it's important for people to know all across this county that every level of government is working together in unison and putting politics aside. And that's the way it should be. And those supplies are critical. Thanks to those conversations, we have been connected to, through the congressman and the White House, a vendor who we are entering into an agreement to secure an additional 150,000 surgical masks, which we will be able to bring into the county today. So that is great news. We will distribute those out as quickly as we get them in. We also need the equipment. I've talked about this before. The governor has been incredibly eloquent on this issue about the fact that we need ventilators here. We're expanding hospital capacity, of course, but it's not a hospital bed if you don't have the equipment. You need the staffing as well. But we need those ventilators. We need that equipment. And I do want to say something about a statement that I saw this morning from some representatives from upstate New York. I believe Elise Stefanik and Tom Reed had put out a statement that was also signed by some other representatives from the state in upstate New York about ventilators and about the governor's order that he will reallocate ventilators that are not being utilized now to the downstate region. As he has articulated, this epidemic is something that we have to fight together. We are one New York, and we are one nation, quite honestly. And again, this is about humanity. And I would hope the statement that was put out, severely criticizing the governor's order to allocate or reallocate ventilators that are not being utilized from upstate New York to downstate, that they will clarify that statement and exactly what they mean there. Because I am certain that they do not mean that ventilators that are not being utilized in upstate New York now or in the immediate future should not be utilized to help save lives on Long Island and downstate. I'm certain that that is not what they mean, because that would be inhumane. And I know that's not, I've never met them. I don't know them. But I certainly do not believe that is what they mean. That's why I'm hopeful they will clarify that statement. No one is suggesting that ventilators, and I'm certain, and I know the governor is not suggesting that ventilators that are needed in upstate New York should be moved down here. But I also know that no one really believes that a ventilator that is not being used or will not be used in the immediate future during this crisis should not be moved downstate. Because if you do that, you will save people's lives. Lives will be saved by reallocating those ventilators. And I can guarantee you this, that ventilators that are being used here in Suffolk County, that are in hospitals in Suffolk County, that are no longer needed, and are needed anywhere else in this state or even beyond, those ventilators will be redistributed, and with my full support. This is about who we are as people. Doesn't matter to me, upstate, downstate. We are all one New York. We're all people at the end of the day. What this virus really bears for all of us is that we have to be together and we have to fight together to defeat this enemy. But the battle and the epicenter of the fight right now is on Long Island and in downstate. And so we need the supplies and we need the equipment. And when upstate needs it, we will be there to support them. I have family that lives upstate New York. I love upstate New York. It is absolutely beautiful. It is, I think, absolutely amazing place. I've met with representatives all over this state of New York from upstate New York. In many ways, our interests on Long Island align with the interest of upstate New York on so many different issues, and I've had those conversations. But this isn't about politics. This is about people. This is about saving lives. This is about humanity. And I think it's important that we continue what we have demonstrated here in Suffolk County, Republican, Democrat, I don't care what party you're in, what we've demonstrated here in Suffolk County is that we're focused on the mission. We're focused on winning this battle, winning this fight, and we will work together, regardless of party, at all levels of government to help save people's lives. And that's what this is about at the end of the day. I want to talk about how we are and have been reporting the fatalities associated with the COVID-19 outbreak. We are and have tried every day to communicate with the public and provide as much information as we can in as transparent a way as possible. And so we have provided as much detail as we can. Our public health professionals are communicable disease professionals who communicate with our hospitals to get the information necessary to report back to the public and also to perform their public health responsibilities, have been securing that information and providing that information. And it's important to provide information to the public, but it is most important now that the public health workers, the hospital workers and the medical professionals who are on the front lines, they don't have any additional burdens on them as they're fighting to save people's lives. So moving forward, we're not going to be providing the same level of detail. We're going to be reporting what the state is putting out with respect to the number of fatalities in Suffolk County. Our public health nurses, our communicable disease professionals will be continuing to communicate and speak to those families who have lost loved ones to make sure that they're following up and that everything they need and all of the guidelines that are out there that they're aware to make sure they're being protected and they can protect their families. But beyond that, the priority here is not reporting details of the fatalities. That was possible to do in past outbreaks, much smaller. It's been possible to do up to this point, but we can see on a daily basis the number of fatalities and how they have been rising every single day. And so for me, the most important thing is for those frontline workers to be focused on their mission. And that is to save people's lives. And that's it. And as far as reporting additional details, that's just not a priority at this point. And we will report on a daily basis what the state is reporting for the deaths in Suffolk County. So I can tell you that the most up-to-date numbers that the state has issued. Yesterday we were at 128. The updated state number, the most up-to-date state number we have is 175 fatalities in Suffolk hospitals related to the COVID-19 virus, and we will continue to report that number moving forward. And that's the priority for us. It's making sure that there aren't additional burdens being placed on healthcare workers who are working to save people's lives every day. We'll go to the rest of the numbers that we have. We're up to 12,405 COVID-19 related cases in Suffolk County. That's an increase of 1,035 from yesterday. We have 28,600 people who have now been tested in Suffolk County, so we're continuing to go up by the thousands each day. 2,200 people overall have been tested. Hospitalizations, we currently have hospitalized 1,435 patients that have COVID-19. That's an increase of 19 patients. I talked about this yesterday. We've been seeing numbers higher than that, significantly higher than that on a daily basis. That number came down yesterday. It's come down again. I'm hopeful that that is a trend that is going to continue, that is an indicator of where we're going. It's way too early to say that is the case. The models, again, show different things. The governor has talked about exactly when the high point of this will be, when the surge will reach its peak. So we don't know exactly when that is, but these are good numbers to be seeing the increase of hospitalizations related to COVID-19 going down. What is going up is the number of people hospitalized for COVID-19 on ICU beds. 540 were in the ICU yesterday. That's 113 additional patients compared to yesterday. That is a huge jump. So we're seeing people who are hospitalized moving to those ICU beds. And again, it speaks to the importance of that equipment and the ventilators that we need. The hospital capacity is 3,186 hospital beds and 742 ICU beds at this point. That's an increase of 162 beds from the previous day. So we're seeing the ICU beds really start to increase and the capacity increase. We have right now in Suffolk County, or as of last night's report, 705 hospital beds available. We have 82 ICU beds available. And the good news, and we like to report this number, and we see it going up, 107 COVID-19 patients were discharged from the hospitals in the last 24 hours. So that is a data point that is good news. We are seeing more people discharged from the hospitals every day who have had the virus and who were sick enough to be hospitalized, but got better in the hospital and have returned home to continue to recuperate. And finally, turning to the economic side of this issue, which we have talked about almost on a daily basis and something that we have focused on from the beginning, but while our priority remains the public health crisis, we have been thinking about the economic crisis that is the result of the COVID-19 outbreak. And we've been looking at different ways in Suffolk County that we could support our small businesses. Our role, of course, is to identify resources to convene, to identify resources, to try to align those resources, communicate to the stakeholders, to small businesses, and to the larger public about what is out there, and then to try to help facilitate access to those resources. But we've also been looking at ways that we can be helpful, small ways that we might be able to directly help as well. One of those from our Department of Economic Development and Planning is focused on our cultural organizations and our arts organizations in Suffolk County. We have an incredible community of cultural arts and artists and musicians, and they are a critical part of our economy. They're a big part of our tourism economy, and they are struggling just like everybody else, just like every other small business out there. And so I've been speaking with our presiding officer, Rob Calarco. Our county legislator, Bridget Fleming, has been advocating on this issue. And so I can announce what we will be doing through the Department of Economic Development is for those grants that are made available to all of these organizations, the funding that is there and that is provided to them, we're going to provide them with more flexibility to allow those funds to be used for payroll, purposes and also for virtual programming, because we understand that that may be a necessity for a while still. And we want to make sure that they have an opportunity to provide that programming to the public at this time, when people are isolated, people are in their homes, creative ways that they can deliver that programming. We want to give them that flexibility. So we are implementing that. And I want to thank Presiding Officer Clarko and Legislator Fleming for their support on that. And with that, I will open it up to any questions you have.
Hi, County Executive Christina Taunton with News 12 Long Island. Thank you all for doing this on Sunday. I have two questions. One is related to the hospital discharge rates that you spoke about. I know that you had said that it had gone up. The governor also spoke about it in his press conference. Have you been seeing a trend in that increasing? And also, when those patients are discharged, does somebody keep track of them? Are they just doing regular medical follow-up, or is the health department checking in with them?
So I'll ask Dr. Piggott to follow up on the second question. On the first part, the numbers are, we've seen the numbers go up on discharges. That's a very good thing. And it's important for hopeful reasons for people to understand, while we're talking about the devastation that this virus has wrought and the number of fatalities increasing, it's important that we look at the data that shows the hopeful aspects of this here, and that is that many more people who go into the hospital come out, they recover, and we are seeing those numbers increase. As the number of hospitalizations have increased, we are also now seeing the number of people coming out of the hospital with have recovered enough to go home and continue their recuperation at home. That's a very good thing. The other number that we look
I realized I never looked at your gifts yesterday, so
the other number that we look at in terms of trend lines is the hospitalizations themselves. And of course, we've seen that go up every day. Those numbers had been climbing steadily and really in the past week jumped significantly, but we're starting to see those numbers go down, daily hospitalizations. Over the last couple of days, there's nothing we can say definitively about that at this point. But again, I'm hopeful that is or represents a trend that will continue. That's a very good thing. We don't know exactly when the peak of this will be. We know we are right in that area now. We know over the next 30 days, this is a critical time. It's why wearing face coverings right now can make a difference. What you do right now will make a difference in the next couple of weeks. Why that's important. Why having the support of the president, the commitment of the White House to deliver what we need here in Suffolk County, that's important. These are all hopeful things. These are all good things for us to be thinking about and focused on while we are fighting the virus. Dr. Piggott, did you want to say anything about how we handle patients who are discharged and any follow-up we may do?
Yeah, hospital level discharge means that the patient is well enough to not require a hospital level of care. It doesn't mean they fully recover, but they're well enough to go home and isolate and finish their recovery at home. In terms of tracking, it's generally the patient will contact us because they need maybe a letter or something to get back to work. That's when we'll interact with them at that point. But generally, that's a good sign when people are discharged from hospitals.
Does that mean that they officially still remain in quarantine from the health department, or that is not required?
Most times they have not fully recovered, so I would say that they are still under isolation.
Okay, thank you. And my last question is either for the county executive or for Chief Cameron. It's about the social distancing and any kind of changes that we may see as we head towards the apex in terms of enforcement when it comes to social distancing and the group gathering.
Chief,
did you want me to answer that, sir?
Yeah, go ahead, Chief.
So far, we have been receiving citizen calls about lack of social distancing. Most times, fortunately, when we arrive, we find that that's not the case. Every time that we've arrived where we have found that that has been the case, we've informed the public and they voluntarily complied. Some of it, I believe, is just a lack of knowledge exactly what to do. When we inform the public, they comply, and we really have not seen any repeat calls or locations. So it definitely seems like the message is getting out to people.
And let me just follow up on that. I want to reiterate what my message has been, and that is stay home as much as you can. If you have to go out, follow the guidelines, social distance. Now, in accordance with the CDC guidelines, put a face covering on when you're out, go back home, and continue to stay at home as much as you can over the next couple of weeks, and continue to follow the guidance moving forward, because we are in this critical stage of this battle right now, and everything we do today and tomorrow will have an impact in the following week and the next week about what these healthcare workers are facing, and will have an impact on how many people ultimately succumb from this virus. What we do impacts that directly. So we are continuing to enforce the emergency orders, the executive orders that are in place that are designed to reduce the impact of this virus. So we will do that. We will enforce that. But I am asking every resident in Suffolk County to voluntarily comply. And look, we have had great compliance. I'm grateful to all the residents of the county who have been staying at home, following the guidance, and have been doing the right thing. Because by doing that, you are making a difference.
And if I can just add, this is the Commissioner Hart. I just want to add our outreach piece. I've been in contact with community leaders in different areas asking for their help. Monday, I've been in contact with the superintendents. I'm going to do a robocall to students so that they understand the importance of this. You know, we're all moving into this very critical time, so outreach is really critical. So we're definitely doing a tremendous amount of outreach.
Thank you, Commissioner.
Good afternoon. This is Darius Rantius with News 12 Long Island. Can you give me context on the 150,000 surgical masks that was able to be secured through this vendor as a result of your conversation with Congressman Zeldin? And then I'll have the second question after that.
Sure, I didn't catch the first part. Can I give you what about it?
Sorry, can you give me some context on the 150,000 surgical masks that you were able to secure? I'm just wondering, how helpful is that to you compared to your needs in the county?
So we are, every day we have a specialized procurement team that we pulled together as part of our response to COVID-19. I have law enforcement that is vetting companies and offers that are coming in from all different places. We have been scouring and searching the internet and vendors for supplies that we can bring in to the county. And so I've had law enforcement vetting companies in China, Taiwan, et cetera. So the conversations with the congressman have led to conversations and outreach directly with the White House, with Jared Kushner, and working to deliver supplies and identify vendors who can deliver supplies quickly here. And that's what these 150,000 surgical masks are about. We are entering an agreement and getting them delivered here. And so that's important, understanding that we are able to identify a vendor that we have confidence in, and at the same time able to deliver those supplies quickly, which is what is happening with these 150,000 surgical masks. And what is really significant, I think, that the congressman has done is get that commitment from the White House that they understand what's happening here, and they understand the needs, and that they will work with us to ensure that we have what we need. And we certainly appreciate the Congressman's efforts. We appreciate the President's efforts on that, and the importance of bringing those supplies here and the equipment as well. As I talked about what the governor is doing around the state and reallocating equipment, it is our hope that we're going to see that happen on a national level as well, continued reallocation of equipment in addition to the supplies that we need.
The reason I asked that question is because some government officials, all the way up to the White House, Dr. Birx, and hospital officials I've talked to in the last several days, they're predicting that the apex is among us, that we're about to reach the top of the apex in about a week or so. Will this 150,000 surgical masks, will that get you through this apex if it's coming this coming weekend? And if it is coming this weekend, getting help within the next 30 days, isn't that a little too late?
Well, the answer is we don't know. We don't know exactly when the apex is. We will know that probably when we are through it and on the other side of it. On top of that, we don't know how long the apex lasts. I know the governor spoke about this. Does it plateau for a period of time before it starts coming down? Or does it hit an apex and start coming down immediately? In either case, there's still going to be a whole period where you are still in the thick of this, even though you may have passed the apex. So we will continue to bring in supplies and distribute them out as long as necessary. And if it ends up we have more supplies than needed, then that is a far better outcome than what we have been facing, which is not having the supplies and not having the equipment we need. If you tell me that at the end of the day, we'll have excess supplies here and excess ventilators, I will tell you that everyone did a great job. That from the White House on down, everyone's done a great job. If we're never in a position, if the hospitals here are never in a position where they have to make choices about who should get the equipment that they need to have a fighting chance to live, then everyone has done a great job. But we know right now that hospitals are splitting ventilators, that they're doing all sorts of different things in order to try to give people a chance to live. So we're not at that point. We need supplies. We need the equipment here. That is critical. And when we get to the point where we understand we are on the other side of this, and that we have hit the apex and we're coming down and the needs are reduced, then we will be more than happy to help facilitate supplies going to other communities across the state and across the country that need it. Ventilators, I know the governor has made a commitment himself that he will drive ventilators to other states that need them. And he will certainly do that with the full support of Suffolk County. We will be there to support others. I know that the healthcare workers here and the hospitals themselves will be there to support with equipment, with staffing as needed to support others around the country. Because again, I talked about we are all one New York. That's right, but we're all one nation too. When I served many years ago now in the Army, I had the privilege of serving for 2.5 years, and I served on active duty, and I was actually based in Missouri, a place I'd never been to before. When I served with people from every state in this country, and we never once for a second, and this anyone who's ever served has that same feeling. You never once for a second thought of yourself as just a New Yorker or a Texan or Floridian. You were an American, and that's what this is about.
Thank you, County Executive.
Sure.
Hey, Steve, it's Denise Civiletti at Riverhead Local. How are you doing?
Good, Denise. How are you?
Okay. Hey, question. in terms of your reporting on fatalities and the change in that,
Yes.
you said that you had 175 fatalities in Suffolk hospitals. And so does that mean that that number does not include deaths outside of hospitals? And the reason I'm asking about that is as you came online, we got an update from Peconic Landing about another person at the facility in Greenport who passed away from this disease at their facility. So does that number, or will your numbers not include fatalities in nursing homes and facilities like that? And if so, will you be providing those numbers separately?
So what I've said is we'll be reporting what the state health department is reporting out about deaths in Suffolk County. Dr. Piggott or Dr. Iftikhar, if you can, if you're able to speak to that with respect to Suffolk hospitals and other facilities in the county where a patient may have passed related
Now,
to.
like, is that a comprehensive number or is it just part of the picture? I guess is really what I'm asking. Thank
Sure.
you.
Dr. Piggott or Dr. Iftikhar, could you comment on that?
I'll leave that for Dr. Iftikhar.
So my understanding is it does include others. It's not only the hospital, but I'll go back and check and report back.
So we will confirm, but as I said before, our priority is to make sure that we're providing as accurate information as we can, as detailed information as we can. But given where we are in the numbers and the crisis that we're in, our priority obviously is making sure that we're not adding any additional reporting burdens on frontline hospital workers who are in the hospitals right now treating patients.
Understood. Thank you.
Sure.
Hey, Steve, it's Rochelle at Newsday. Hope your Sunday's going okay.
Every other
question. What'd you say?
Just like every other day.
Yeah, right. Every day's a Wednesday. So with the surgical masks that are coming in, you said that the county's entering into an agreement for them. So I'm assuming that means that they are paying for them, that it's not a donation. And if that's the case, do you know about how much the county's expecting to pay for them?
Correct. That is correct. I will get you the numbers on that. I don't have that off the top of my head, but we will get you the breakdown.
All right, thank you. And then I know obviously on this call, there's been mentions of increasing outreach to the community and also stepping up, trying to get supplies. But could you give our readers just kind of more of a sense of overall what the county is doing to prepare for the apex that's expected to come?
Well, the preparations have been in everything that's been happening over a period of weeks here. The governor has been leading this effort and I think has done exactly right by saying that we are all one state. We are working together. He's worked closely with the president at the federal level also to bring in resources, the Army Corps of Engineers, and focused on expanding bed capacity, and obviously has continued to focus on getting the equipment here we need, which we need more of, and the staffing as well, and putting all of those pieces in place. And we have been all along the way playing our role and doing our part within this system to support all of those efforts and to work with the hospitals to support increasing capacity and delivering out the equipment and supplies that are needed to the different agencies, trying to fill the gaps on a day-to-day basis where there are critical shortages. So we continue to engage in all of those efforts on a daily basis. And as I said, every part of the government is involved in one way or the other in the response, but the core of this is the battle that's being fought in the hospitals right now to save people's lives. But every agency in the government, from the police department, our first responders, to all of the 311 call takers, to the people in DSS who are processing SNAP applications for people who now suddenly need food stamps. All of that every aspect of this government is engaged in this battle fighting the COVID-19 virus.
We'll take one more question.
Steve, just to clarify, so those are surgical masks, not N95 masks, right?
Correct.
And maybe Dr. Piggott, could you give us an idea of how many surgical masks, N95 masks, gowns Suffolk County needs, each day? Like how many are used and have to be discarded each day?
Yeah, I don't have that number. It's another department that tracks that.
Okay, what department is that?
The burn rate is very high on those. We distributed over, by the way, I talked about this yesterday, over 1 million of the surgical masks or ear loop masks already.
Okay, thanks.
Sure.
Steve, hi, it's Dan Denea from the Times-Picayune Record newspapers. I know on Friday that the number of ICU beds was down to 43 available beds, and I know that what you just mentioned is that over 100 ICU beds were needed in the last 24 hours. Where are all these beds coming from between Friday and today? Are hospitals reshuffling where people are? Are they making larger ICU facilities available? How are the numbers shifting so dramatically from Friday to today to accommodate the incredible need for the beds? And how are the available beds in the 80s again?
Well, remember, Dan, you've been on the calls beginning of this week. We said we're going to see the numbers of hospital beds rising. They were going up slowly at first. And I said, as we get later and later in the week, they're going to start to jump more significantly, because remember the governor's order last week sometime, or 10 days ago sometime. The days are running into each other exactly when that was, but the governor's order was a mandate to increase bed capacity by 50%. Now, you don't do that overnight. It's not going to happen immediately. We had been already working with hospitals and the state, identifying and evaluating facilities. So they've been executing those plans within their footprint, current footprint, and by working to identify additional leased space for some hospitals. So they've been every nook and cranny in a hospital. They've identified that can be converted, that they can put beds into. That's exactly what they've been doing. And then you have some equipment there and you're able to staff it. Now it's a bed, you can put it online and you can put patients there. So that's what's been happening in all the hospitals.
Okay, and then in terms of the what you described yesterday in terms of the plasma from people who have recovered, given that there are the numbers of people are increasing who are leaving the hospital, is there any follow-up contact with them once they've recovered for reaching out to see if they might be willing to contribute to helping, paying it forward, to helping those who are falling ill now, who might need some of the treatment that includes their antibodies?
Well, I think that's exactly right. We spoke yesterday about the Red Cross looking for donors, and we will be, I think, increasing the outreach to individuals we know who have confirmed positive. Now, somebody just coming out of the hospital, we're not going to be looking to get their plasma, but somebody who, as we move forward, has been out and really hasn't been hospitalized, that would be more of the target. People who have confirmed positive but maybe weren't very symptomatic or were relatively asymptomatic, they would be ideal for the convalescent plasma treatments, to be able to donate their plasma and utilize those antibodies to help treat people who are currently hospitalized and suffering from the virus. So I think that is where our focus is. But yes, as more people recover, the opportunity to successfully secure the plasma that would help in this process. And this is being evaluated for the impact as well, too. That's important. That's very important to know, because if it is having a real impact, then the urgency of the call will become greater.
Great, thank you.
Sure.
All right. Thanks, everybody. We'll be back tomorrow, same time.
Thank you, everyone. Be safe out there today. Thank you.